When he went into retirement, he would just paint. Watercolor was like his passion towards the end of his life.
For most of the last decade of his life, Howard Conyack lived here with his daughter Tanya Montuore and her husband Rob.
Are these all paintings that he...
Yes, these are all paintings, and I look at this as a lifetime of what made my dad and how this made me the person I am today. It's everything, it's his life in a box, really. It's just an empty canvas that comes to life, and that's who my dad was.
Conyack spent decades working in advertising. Before that, he served as a Marine, stationed in Japan.
Howard was so proud about being a Marine. Like, once a Marine, always a Marine.
Anywhere we went, if someone had a Marine shirt or Army or anyone that is in any service unit, my father could speak for hours.
The Montuores never wanted to put Conyack in a home, but in February of this year, after a fall, they temporarily moved him into the Menlo Park Veterans Home, a well-regarded facility run by the state of New Jersey. 2 months later, as the coronavirus pandemic spread through the country, Conyack was dead. What happened to your father at Menlo Park?
He was excited to move to Menlo around March. As the days started rolling by, the communication was getting sparser and sparser. I tried reaching out. I couldn't get anyone to call me back. I found out that my dad was having respiratory distress.
And they told us he was on oxygen.
And I kept saying, is anyone testing? When I finally reached the nurse practitioner, does my dad have COVID? No.
Was he scared?
Yeah, he was
scared.
He was absolutely scared.
April 3rd, he called, and this you want to?
I have the audio if you want to hear it.
Can I play it for you? Yeah.
Get your phone.
This is haunting me.
You got the speaker on?
Yeah.
Yeah, there you go.
Hi, T. It's me. It's 11, I think, o'clock. We have a lockdown in our squad bay, so I can't use the phone too much. I'm worried, honey. I'll talk to you if I can later on. I think I have one of those little similar. Yeah. I love you, honey. If anything happens to you, I miss you so much. And Bobby and the dog. Bye, honey. Talk to you hopefully later. Bye.
Nursing homes were some of the worst places to be during the early weeks of the pandemic. But even by those standards, what happened at veterans facilities in New Jersey was a catastrophe. Officially, 62 residents died at Menlo Park from COVID-19 since the beginning of the pandemic. At Paramus, another nearby state-run facility, some 81 more passed away. But interviews with staff and family of residents, congressional testimony, and documents obtained by Vice News show that the real numbers are actually much higher. Before the pandemic, Menlo Park had more than 300 people living there. By September, it had 169. In the month of April alone, 94 residents died. Many of them, like Howard Conyack, were never tested for the virus. Now, dozens of family and staff members are suing the facility and the state, saying they failed to follow proper protocols for infection control. And they say that throughout the crisis, the leadership of the homes spent less time taking care of the sick than they did concealing the truth about just how bad things really were. One person who knows a lot about what happened is Shirley Sudduth Lewis.
Hello.
98.1.
98.1, that's good.
Okay.
All right.
She was a nurse at Menlo Park for over 36 years before retiring in August. She still represents the nurses at the facility as the staff union president. Were they prepared for this?
They were not prepared for it. They dropped the ball on the staff, and instead of acknowledging that things went wrong, they're wrong and strong. They're blaming the staff. You know, the staff can only do but so much.
Sudeth Lewis is one of several current and former employees who told Vice News that administrators repeatedly made decisions that exacerbated the crisis. In mid-March, as it was becoming clear that COVID was going to hit nursing homes hard, Sudeth Lewis and 2 other employees say the director of the facility, Elizabeth Schiff-Heedles, forbade nurses from wearing face masks, arguing that it would frighten residents. The nurses also say administrators failed to properly isolate patients who became sick, and at times seemed almost willfully blind to the disease's spread.
They said we didn't have any COVID in the building. But it's a funny thing. How do you know when nobody is being tested for it?
In late March, Sudeth Lewis was exposed to a resident with COVID. She was sent home. But she says a week later, she started getting phone calls from management, urging her to come back to work.
And they said, I want you to know, I hope you're fine and everything like that, but we need people to come back to work. You need people to come back to work and you don't even know if they're positive or negative or what. When I was out, I was getting texts every day. This one died, that one died. 5 died today, 3 died yesterday, 2 died in the same room.
One of the residents who died was Sudeth Lewis's patient.
I had a panic attack one day when I got home and I could not. I just kept seeing her face, her face, her face, her face. Every time I think of it, I couldn't even go to work the next day. I called my doctor. I said, you have to give me some anxiety. She ordered me something for anxiety. She said, you should not be going back there.
Who do you fault for this?
I fault management for dropping the ball on us. We could have started wearing PPE earlier.
Did it feel like they were just making it up as they went along?
They were.
They shouldn't have been. In 2018, a viral outbreak at a long-term care facility in New Jersey killed 11 children. Afterwards, the state passed laws requiring all similar facilities to have plans in place to deal with infectious disease. Although the CDC's guidelines for the general public on wearing masks were ambiguous in the early days of the pandemic, by late March, federal guidelines for nursing homes were clear. They were expected to use proper PPE when dealing with suspected COVID cases and cease all group activities. But Menlo Park wasn't doing that. On April 12th, they were still gathering in groups. Schiff-Heedles, seen here leading the dance, declined to comment and directed us to statements from her department. Her bosses at the New Jersey Department of Military and Veterans Affairs have also been dismissive of criticism.
Thankfully, we as humans don't form our own sense of value or self-worth based on the words or conjecture of others seeking to misinform or further their own personal agenda.
More recently, state officials have begun to take action. In October, the Department of Health added 39 more probable COVID cases to Menlo Park's tally, bringing the total to 101. And the Attorney General has opened an investigation. In a statement to Vice News, the Department of Military and Veterans Affairs flatly denied the claims of employees and family members. A spokesman said that the department followed all state and federal guidelines and required staff to wear PPE. He also insisted that employees were never asked to come to work if they had COVID-like symptoms and aren't being retaliated against for speaking out. Meanwhile, more than 100 staff members at Menlo Park contracted COVID. One of them died. This current employee, who would only speak anonymously out of fear of retribution, says things haven't really gotten better. What's it like there now?
Now, everybody's threatening. It's scary because they're retaliating. I've never, in the years I've been there, seen as many people being fired. They think whatever happens in the facility should stay in the facility.
Is the facility prepared for a second wave?
Honestly, no. I don't think they're prepared for the second wave. They're still not giving us N95 masks. We're using paper masks.
Who's responsible for how chaotic it was?
People that ran the facility at the time. That's who I blame. I blame them for the death of the residents. We trusted them. The families trusted them. The residents trusted them. There was no nursing staff at all. They even lied about the amount of patients that passed. They took all the dead residents' wheelchairs and put them in water edge dining room. And it took up the entire dining room.
Oh, it must have been horrible.
It was horrible. It was horrible.
Family members like the Montuores say somebody needs to be held accountable. Is this Menlo?
This is his room that we
That
took.
was his room, and that was
Room
his
511.
welcoming.
Do you know what happened to these people who are in these pictures?
I suspect that the same thing happened to Howard, happened to every single one of them.
And I know he's giving us a sign.
He's telling us to fight for him and for all of his brothers, because it's always remembered, Semper Fi, you know? And I'm gonna make sure that they pay for this. And someone's gonna be charged.
If this takes me 20 years to get justice, before I close my eyes on this earth, my dad's gonna have justice.
Those affected by the state-run facility's COVID response are still trying to get answers. In September, they held a protest outside Menlo Park.
Yesterday, I got a call from a few of my members. They were being threatened if they went to the rally that they would be disciplined. Hi, are you family members? I know him, he was on Eagle.
Oh,
This is
That was
my guy, right here, this is my guy.
that's how.
Okay, my name is Shirley Lewis, son of Lewis, and we put this together in order to give you guys a voice. We need all the help we can get. Somebody has to be accountable for what's going on.
Absolutely.
We entrusted the leadership at Menlo Park to care for someone we deeply loved, who they devalued as a human being. The insensitive and absent lack of care for my father and the other veteran heroes caused countless unnecessary deaths. My question, and I'm sure you all have the same, is why?
We have a saying here. We serve those who served us. So we're gonna have to get busy, and I expect for every single last one of you guys out here to keep the fight going, because somebody has to be held accountable. Somebody has to be held accountable. Today, not only do we mourn the great loss, we come together to celebrate their heroic, honorable, and affectionate lives.